it's about time to talk a bit more about the quality of the data that we're using to inform our decisions, and that's being used to inform the decisions of legislators who we put our faith and our trust in. The reason that we choose them to represent us is to improve the lives of the citizens that they represent and to act in good faith for their best interest, to be their ultimate well-wishers. And you would assume that they do this and that they seek information to support that, information that can be relied upon. But the quality of the data and the method of analysis that we've been using is a little bit unique now. It doesn't fall in line with previous practices. There's been evidence in, at least in many cases, and it might be broadly the method that's used, that that the statistics on mortality and the standard of requirements for giving a diagnosis of a post-mortem analysis that someone's death is attributed to COVID is not really similar, or not at least equivalent to that which we've used for other diseases that we use for the seasonal flu, for example. There have been many cases of this. I'll put some links in the description. You can check that stuff out and give your opinion on that. And this is not my opinion. I'm not an expert in epidemiology, in biopharmaceutical sciences, and in health policy, but there have been lots of professors and doctors who have come forward. There's Dr. John Ioannidis, professor of medicine, of health research and policy, and of biomed data science, and of statistics at Stanford. There's Professor Knut Witkowski, that's former head of Department of Biostatistics, Epidemiology, and Research at Rockefeller. Dr. Annie Bukasik is a physician, I believe, in Montana. Another Dr. Jay Bhattacharya, professor of medicine at Stanford University. He's also got, I think, a doctorate in economics. I'm not sure. There's Dr. Wolfgang Wodarg. He's a pulmonologist from Germany. Dr. Sukarit Bhakti, he's a professor emeritus of medical microbiology at the Johannes Gutenberg University. So no slouches, and not outside of the context at hand. They're actually the primary types of experts that we should be seeking the opinion of. But when I look them up, I see lots of quick little write-offs and debunks saying that all these idiots are spreading this info and they might be doing it for special interest. We don't know, but we should assume it because what they're saying could theoretically be damaging and could hurt people. But a lot of things hurt people. Is it in your grandma's best interest if we keep her in a locked cave and never give her any attention again because we might breathe on her? Maybe that is the best thing to do. Maybe we do want to have pure separation and live in a virtual world. That's a worthy conversation that a lot of people might want to have. But we need to talk about the reasons that we're doing things with the expectations that we have attached to them. So the expectation is that we live in an isolated virtual box and that we rely on modern techniques to extend lives and not have to worry about disease. Then that should be the stated expectation. But that's not really the stated expectation. The stated expectation is that we're going to go back to normal life as we knew it before, which of course will never happen because that was the past. We don't know what's going to happen, but certainly people's values have been affected. You have a new value hierarchy with every action and every moment. It might be a lot like it was before, but it's always being reformulated and recalibrated. So as we get used to different types of interactions and different causes for concern, then we should expect that our values are changed, and what is considered normal in a life is also going to have changed. So if we're hoping to go back to how it was before, that's probably the wrong thing. You should be thinking about what kind of future it is that you want, and whether the way you are participating in reality at the moment is making the future that you think you would define if you were to take that moment and try to define it, your ideal future. But data continues to be a major buzzword. It's used by experts and lay people. And when anybody uses the term data or states their reliance and use of data, it automatically gives them some credibility. It carries weight, even just the word. And we've heard from the outset of the coronavirus and COVID-19 reporting, there was a strong emphasis on ensuring that data is available. Data, I can never really decide. To inform our decisions of public health officials and legislators. And so, of course, early on, unfortunately early on, all of the earliest data was coming from China. Moreover, it came from Wuhan. It came from Wuhan, which is not only notoriously well known for extremely high pollution, air pollution, probably the worst in China. I was even checking today, and I know there's been a lot of glowing reports on how the world is cleaner, the air is so nice now, and the animals are coming out of the woods and hanging out, monkeys in the streets in Thailand, etc., etc. Even now, it's still the worst pollution. You can check some charts. I'll put some links to that as well. But not only is Wuhan known for pollution, they also had record protests, or at least unprecedented protests, which were widely reported, mostly because the state is contributing to greater pollution. They've built new incinerators, and a lot of people think that their kids are getting sick, so they're coming out in droves, getting beat up by cops. And I wonder if they're doing that now. I don't know, maybe not. Of course, I'm not saying it's a conspiracy, but I'm just saying that there's a lot of reasons to question information coming from that region. Been conflicts as it stands. So, and for anyone in Canada, we arrested the finance executive of Huawei last December 2018, so the previous December. And if you've worked in IT, I remember even working in the government, like over 10 years ago, and they were always talking about how, there's Chinese and North Korean spies, so we're upgrading the security, we're upgrading our networks, we're changing our protocol. You don't hear that as much in the private sector, but they usually do things much better anyway. I'm in the private sector now, by the way. So we already know that data from China shouldn't necessarily be trusted, and the intentions of the Chinese authorities shouldn't necessarily be trusted. They're employing their own private companies as extensions of the state. So, knowing all of that, why haven't we questioned the data coming from China, or why wasn't there even a conversation about whether it should be trusted, about what kind of extra scrutiny should be given to it, about what possible benefits or incentives might be attached to its dissemination? Don't really remember that, hindsight's 20/20, but that would seem to be a reasonable thing to consider from the outset. The WHO didn't employ that. Instead, they went to Wuhan. Supposedly they had very limited, or they had some limitations in their ability to see all the information, but they left with the understanding from the health experts, from the Chinese government, that there's no human-to-human transmission. And this was late January, right? Wuhan, supposedly, and I remember seeing the videos, they had cases in early December. Who knows if they had them before that, but if they had known of cases in December, and there's a remarkably high infection rate, high transmissibility, and an incubation period of, they're saying, I guess, somewhere in the 8 to 20 day range, depending on whose definition you go by. It would seem likely that they would have at least known that for sure. Maybe they were incompetent. Maybe the WHO is incompetent. We should probably have that conversation too. But even to assume their incompetence, which would be the most charitable perspective, that would be rather naive.